Welcome, everybody.
I'm Dr. Linda, and the founder of Abundant Life World Ministries. I'm joined by my husband, Pastor Mark Corley, Dr. Renee Harvin, and Miss Stacy Williams from the Behavioral Wellness Center. We're just so excited to have you all here today. God bless you for tuning in. We are talking about some important things today. So we're demystifying, mental health. It's so important because we know that God, He renews our minds, He restores our souls, and He really does care about the state of our minds. And right now, there's so much going on in this world. We're still in the pandemic. We have our own personal family struggles. We're balancing whether you're working, you're a mother, you're a wife, you're a daughter, you're a son, you're a husband. I mean, everyone is just dealing with their own struggles in their own ways. And this is something that we find to be a little difficult to discuss, especially amongst church folk, self included. I mean, the conversations about mental health are a little bit almost taboo. I don't know if you guys feel the same way, but it's almost as if we try to separate the physical, the mental, and the spiritual, and they really all go hand in hand. And so I'm so happy to be with you all here today. We're going to take questions and answers. We have a fantastic presentation from Dr. Harvin coming soon. She's just a wealth of knowledge in this field. And so, yeah, I'm ready to have a good time. Say hello to our guests. Our guests can say hello as well. Oh, you guys are all on mute.
Hello.
So this is Dr.
Hello,
and Miss Stacy Williams, and my husband
Hello.
hello.
video is not on yet. All right.
I'm here.
Oh, hey. You want to introduce our guests so we can get started?
Right, right. So, thank you so much. First of all, I want to acknowledge our viewers online on our website, www.abundantlifeworldministries. Those on Facebook and on YouTube as well. Want to acknowledge everybody. Thank you so much for joining us. I know we have such a huge following coming from Zambia, and they have lots of questions. So this is how things are going to go today. Our resource person is ready to share a word of wisdom with us. Um, if you want to join the discussion, I'm going to paste the Zoom link on the Facebook broadcast. It's going to be in the comment. You can click on it, join the discussion live. If you have any questions, that can also be entertained. Or what you can do is just ask your question in the comment section on the Facebook Live that you are all on. Okay, and the question will be read to the resource person. Okay, so wherever you are, you can definitely participate. Okay, there is no question that is a wrong question. All right, so we have Miss Stacy Williams. She is from the Behavioral Wellness Center at the Gerald in the Philadelphia, Pennsylvania, and such a wonderful friend to the family and ministry. We are so glad to have you with us. And our resource person, Dr. Renee Harvin. We are so excited to have these powerful women with us, and of course, my wife, Dr. Linda, for being here as well. It's going to be a great time. All right. So, what we are going to do, Miss Stacy is going to speak to us briefly about the Behavioral Wellness Center at the Gerald, and then from there, we take the presentation on mental health from Miss Dr. Renee Harvin, and then we take the discussion and questions and answers after the presentation. All right, Miss Stacy, over to you, please.
Am I on? Uh, Good afternoon. I'm Stacy Williams, and I'm going to talk to you very briefly about the Behavioral Wellness Center, or the Be Well Center as it is commonly referred to. The Behavioral Wellness Center is a Philadelphia drug and alcohol treatment center offering both inpatient and outpatient psychiatric and substance abuse counseling and treatment. We were formerly called Jeffrey and the Girard Hospital, and now we're referred to as Behavioral Wellness Center or the Be Well Center. And the telephone number is 215-787-2407. We recently procured a RV so that we can go and I say do ministry but do marketing in the Kensington area and other areas that are drug infested. And we're very proud of that. Again, the telephone number is 215-787-2407. Dr. Harbin.
Good afternoon, everyone.
Good afternoon.
I currently work at the Behavioral Wellness Center as a counselor. I just recently received my doctorate's degree August of 2020, and I am looking forward to putting it to use in other areas soon. I'm very honored that I was asked to do this presentation. My PhD is in human services with a clinical social work on human behavior. And I did some research and hope to, this presentation will help you to understand more and get a different viewpoint on what mental health is.
Amen.
Awesome, awesome. That's great. So, Miss Dr. Renee, I do apologize. I'm going to get used to that in a little bit. We're going to hand over to you. You can share your screen with us, and then we'll all be listening for your presentation afterwards. We'll come back, take questions, and have a good discussion.
Okay. Let me see. Make sure.
Shout out to our viewers. I mean, we have viewers from all over the world right now. We've got some viewers from Kenya, we've got some viewers from Zambia, from Ghana, from right here in the US, from Philadelphia, I mean, from Ohio. We're just so excited to be here with you all. And we're super excited to have partnered with the Be Well Center. And so I think this is going to be so fruitful. I think it's going to be a wonderful discussion.
Okay, I'm trying to see. Okay, can you guys see this?
No, not yet.
No?
On the bottom, you should have a share screen button. Screen.
I clicked on it. And...
You might have to click it again.
Okay, wait a minute. Now?
Okay, hold on 1 second.
Okay, I'm gonna go back out. Okay, I'm gonna try it again.
Okay.
Okay.
Let's see.
It's telling me that it's failed to start to try again later. I have a code number on it.
Okay. No problem. So what we are going to do?
Um,
Can hear.
While you guys try to share the screen, maybe Dr. Renee can send over her presentation to Pastor Mark, and then he can share the screen, and we can go through that way. But I
Oh,
do take a moment to take some questions in the comment section. We want this presentation to be as beneficial for as many people as possible. So if you guys have any questions, comments, anything that you're really hoping to get out of this discussion, feel free to put in the comment section. We'll hope to get to it either in the presentation or in the question and answer session afterwards. I know that, this is such a broad topic. We've got people who are dealing with drug addiction, alcohol addiction, people who are dealing with depression, people who are dealing with just suicidal thoughts. And these are all things that, well, some things are new that we deal with in the 21st century, but some things are centuries old. I mean, we had people in the Bible dealing with suicidal thoughts, with depression, running away from God's calling. And so, any questions that you guys have, any topics that you guys want us to delve into during this presentation, we would be super happy to see that and be able to impact as many people as possible.
so in the meantime, my first screen was asking you guys to think about what does mental health mean to you? How do you view mental health? And if they can put in their chat their views, or what is their understanding of mental health, then maybe I can gear towards information about, making the right kind of information. I just like to have, what is your idea about mental health? What are your viewpoints about mental health? Okay, I'm about to send this to him now.
So someone is asking, what is mental health in its simplest form?
Okay, so mental health in its simplest form is having a healthy point of view in a positive manner, having good mental health, meaning that you are aware of your emotions and your feelings, you have control of these things, you're able to function daily, and you're able to make adjustments when it's time to make adjustments and different things of that nature. I'm having so much trouble with this computer. I'm sorry.
Okay, you know what?
You're doing fine.
You got it.
Okay. I'm ready to send this browser. Trying to multitask.
So some information I found out as we were preparing towards this. Somebody gave a definition for mental health as having a good mental, being generally able to think, to feel,
Yes.
to react in the ways that you need and want to live your life. That is mental health. Being able to generally be able to think, to feel, and to react in ways that you need and want to live your life. So if they, and of course I'm not a mental health expert, but I can say that as a man thinks, Bible says that so is he. Okay, so if the thinking, the feeling, and how we react to things are out of place, then that definitely is not a good mental health situation that we need to be in. And we shouldn't always have to spiritualize situations. There are people who can help, and there are places that we can go to receive help.
Exactly, Pastor. That is exactly true. The mental health from referred to by the WHO, the World Health Organization, theorize exactly what you said, a state of well-being in which the individual realizes his or her own abilities and can cope with the normal stresses of life and can work productively and fruitfully and is able to make the contribution to her or his own family and community. So good mental health, a person feeling in control of their emotions, have good cognitive functioning and have positive reaction with people around them. So that's mental health. But then there are problems with our mental health. And that's when the different aspects and perspectives come in, the taboo, the different things, especially like Sister Linda said, that um, us in our culture and spiritual, we don't see it as a problem where we need to seek help, you know. And I truly believe that God created psychologists and therapists and counselors and gave us the wisdom and the knowledge to be able to help others that have problems. So that's where we're going to jump into, like looking at exactly what mental illness and mental disorders are about, and find out exactly how it is diagnosed and how it can be treated, and what we will do about it, what we can do about it on our own.
Mhm.
So I sent the PowerPoint. I'm not sure if you got it yet. I just want to make sure it went directly to you too.
So I will recommend just, you can start the presentation, with
Yeah, I'm just going to start it. I'm sorry you couldn't see the beautiful
it.
I'd like to see your face.
PowerPoint.
As soon
So,
as, it comes through, I'll share the screen.
okay, if it comes. Okay, so my first screen was the question I had asked you. Um, sometimes people define and perceive people by their perceived conditions, and sometimes there's discriminations and stigmatizations that are associated with mental health, with people being referred to as schizophrenics and manic and crazies. And this type of labeling is derogatory and disrespectful, which can become shameful, have shameful feelings, and create barriers towards recovering from it, not wanting to seek help, not wanting to admit that there is a problem. Okay. So the Mental Health Association indicated that that there are different ways of defining mental health, with emphasis on positive and psychological well-being, or as absence of mental health. And I pretty much read that to you already. So what are mental health problems? There are many terms to describe mental health problems: serious emotional disorders, extreme emotional distress, psychiatric illnesses, mental breakdown, burnout, and mental disorders. And we're going to look at mental illness and mental disorders. I just wanted to, let me see if I can play. I can't play the video for you because I can't share the screen, but I had a little clip with people talking about being ashamed of their mental illness or depression or substance use and different things like that. So to take the place of the video, I will share some of my experience and background. So I've been sober and clean from drugs and alcohol for over 24 years. And during such times and during my sobriety, in the first few years, I, I suffered from some depression and different anxiety. And I didn't want to believe that there was anything, wrong with me, because I went to church. I prayed and praised God, and I believed in God, even being in school and different things like that. I had just started my master's program when I was hit with a bout of depression. However, I sought help, and I did speak to a spiritual counselor and a professional therapist that helped me. I was fortunate enough not to need medication, but the therapy, lasted for about 6 months or so, and it helped me a whole lot. So there's nothing to be ashamed of. You can identify any persons you have been affected with in mental health in your family, and what was your perceptions at that time. Like, no one would have known if I didn't tell them, because of the not wanting anyone to know. But when it got to a point of disparity, I had to reach out and I had to talk to someone. So this videotape were about 4 people sharing their experiences with about mental health. I also wanted to talk about some of the history on mental health with cultures, certain cultures, how they perceive mental health as a form of religious punishment or demonic possession. Ancient Egyptians and Roman scribes and Greeks in the 5th century, long time ago, indicated that mental illness was characterized as a religious or personal problem. Then there were pioneers such as Hippocrates, who treated mental illness with people focusing on focusing on their environment and occupations instead of techniques rooted in religion or superstitions. During the Middle Age, the mental ill were believed to be possessed or in need of religion. So it was almost the opposite. And negative attitudes towards mental illness persist in the 18th century. And in the United States, leading stigmatizations of mental illness and unhygienic, often degrading confinement of mentally ill individuals. Okay, I'm going to my next slide.
I was actually going to say that I saw that you said your video had 4 people sharing about their mental health experiences. I mean, we have 4 people here. We could share too.
That would be great. I appreciate
Yes,
that.
For me, I'll say, so I'm a year and some change out of residency. And I'll say that, we deal with like some pretty abnormal circumstances just in the medical field on a daily basis. And so I'll say for me, in the beginning of residency, I had a bout where I was so stressed out and so overworked and so tired that I ended up needing to go to a therapist. And it was interesting because we have this thing about making sure everything looks put together on the outside.
Yes,
We could be
as women.
suffering so much on the inside, but you better show up to rounds and know all of your information and you know, having some sort of supplement or everything going just fine with you, because God forbid if it's not. It's a poor reflection on you. It could be a poor reflection on, and these are all myths, but it could be a poor reflection on your prayer life. Oh, so maybe you don't pray enough, or
Mm,
maybe you're not close enough to God. Why are you so stressed? Why are you so anxious? Um,
mm,
or it could be a poor reflection on, oh, well, maybe something bad is going on at home. No, we all have like significant stressors in our lives. So at that point in my life, I think I was doing like 28-hour shifts every third day. I had patients like dying literally in my hands, like frequently in the cardiac ICU. And I just got to a point where I felt like, I didn't want to hurt myself. I've never felt like I wanted to personally hurt myself. But I said to myself, if I don't wake up tomorrow, that's totally fine with me, you know? And that
mhm.
to me was a turning point where I was just like, I have to like see someone. This is crazy. I shouldn't feel like this. I'm generally able to adjust really well to situations. Like I've been through a lot of things in my life where I'm able to kind of adjust and get back on track. Um, and I think as a Black woman, resilience is something that is really,
Yes.
really put. I mean, it's like you got to be able to snap back no matter what is thrown your way. And
Yes.
you can only do that for so long. You can really only do that for so long. So, but I saw therapy and it was so helpful. I mean, it helped
Yes.
unpack some of the reasons why I was feeling the way that I was feeling. It helped me to be able to cope with some of those feelings and
Yes.
kind of deconstruct some things that I had in my mind about how I was supposed to cope, how I was supposed to be perceived in the community as someone who wasn't biased, who didn't like have to be so.
Yes, Linda. Thank you so much. Are you? I can't hear you anymore. But were you finished?
Oh yeah, I'm done.
Oh, okay.
I could talk
Thank you
forever,
so. I know, because it's so relieving once we have accepted, and then remove the stigmatization away, and that's the big thing. We had to remove that stigma and what other people are perceiving of us, because we had to take care of ourselves in order to be able to walk in the will of God and do what he has to do. So if we're going through things and it doesn't show that we have lack of faith, it's because we're growing or being stretched, and we need to be able to recognize the kind of assistance we need. And God provides that through people professionally to help us, to understand. So once we accept and become aware of what's going on in our lives, then we can reach out for the help. And we don't have to worry about what others say, because then it's about, I got to get me together. I have to do better than this. And I do want to live today. And I do want to do what God has given me the power to do, the call that he gave on my life. But I can't do it by myself, because I need God, and I need people and socializations and understandings and different things, especially when we make a change in our lives and we're no longer doing the things we used to do. The renewing of the mind, as Pastor said earlier. We need to be able to continue to do that and persevere. Yes, and we need each other, most definitely. Anyone else want to share?
Oh, definitely.
So for me,
Yeah. Let's go.
I had an experience, the same experience 6 times of postpartum depression. I have five sons and one daughter, and each of my pregnancies, once the child was delivered, I suffered from postpartum depression, and it was awful. I mean, it really was. It was so that I barely could take care of the infant child. So that was my experience with depression. And even from time to time, when things get rough for me now, I can still go back to that depressed state. So I find it necessary to stay in therapy. I stay in therapy, and that helps me a lot.
Okay. And there's no shame in it,
No,
right? No
no,
shame
no
whatsoever.
shame for me. No shame for
Pastor,
me at all.
you were going to say something?
I was saying, with reference to the depression and my story, just moving from Ghana to the U.S. With a change of environment,
Yes.
I went through I went through a lot of mental, battles, just trying to adjust. But I wouldn't say that I went to a therapist. I dealt with it in prayer, but everybody is different. Everybody
Yes.
is different. And so when you understand what you are dealing with mentally, when you understand what is going on around you, then
Yes.
you are able to find the nearest place to get assistance. Okay, there are so many questions that are coming up in the comment section. So what we are going to allow you to do is to finish up the presentation, that we can go to the questions and then for
Okay. Thank you. Excuse me. So more history. Looking at during the 1940s and 50s, where they were trying to deinstitutionalize the patients from being in these dramatic places where they were doing, and I had another PowerPoint, another little video to share, the different treatments that they were doing that were really torturing them, from wet blankets to putting them in restraints, putting persons that were manic, or because to me, I perceived that there wasn't full understanding of how to help these people, all the way to where they were doing lobotomies, going in the eye socket and removing the nerve to stop you from functioning. Um, um, the institutionalization and outpatient treatment began in the mid 1950s in many countries. And this was facilitated by the development of a variety of psychotic drugs. The Community of Mental Health Centers Act in 1963 organized the close of state psychiatric hospitals in the United States, and strict standards were passed so that only individuals who posed an immediate dangers to themselves or someone else could be committed to state psychiatric hospitals. So today we have many experts that by improving community-based programs and expanding inpatient care to fulfill the needs of severely mental ill patients, the United States will achieve improved treatment outcomes and increase access and mental health care to better quality of life and for mentally ill. So like the closing of the Norristown Hospital and the closing of Byberry as it came about, they're being placed now into either back into their family homes or nursing homes and different things like that. But today there are a couple or a few that I know of, like PHMCC in the Philadelphia area, that are nonprofit organizations that provides special treatment, that nurses, case manager, they have a whole team to come out and help the persons that are severely mentally ill. So mental health disorders, what is that and what does that mean? Mental health disorders sometimes refer to as illnesses that affect the person's thoughts, moods, and behaviors, and disrupts the person's ability to carry out daily activities and engage in satisfaction for personal relationships. Mental disorders or mental illness is a diagnosable illness. Mental health disorders may be occasional or chronic, and they affect an individual's ability to relate to others and function to day-to-day life. While these are some serious and may require professional intervention, a mental health problem includes both mental disorders and symptoms of mental disorders. They may not be severe enough to warrant a mental diagnosis. However, there is still treatment available, if you're just going through certain things. So there are different types of mental disorders. So today we will focus on, we're going to look at 5 common ones: anxiety disorders, mood disorders, psychotic disorders, and dementia, and eating disorders. So I'm gonna briefly talk about the last 3, but we're gonna kind of get into anxiety and mood disorders. Okay.
Right.
Okay. Anxiety disorders. Anxiety disorders. Let me get my paper together. Cause people to experience distressing and frequent fear and apprehension. While many may experience these feelings, say during a job interview or public speaking event, as that can be a normal response to stress. Those with anxiety disorders feel them commonly and in typically non-stressful events. And bouts of anxieties can last up to 6 months or more at a time. The most common categories of mental health disorders in America impacts approximately 40 million adults, 18 and older. Anxiety is a blanket term that includes a host of specific disorders, including generalized anxiety disorder, obsessive compulsive disorders, panic disorders, post-traumatic stress disorders, and social anxiety. Generalized anxiety disorders consist of excessive anxiety and worrying, apprehensive expectations, and this is according to the DSM-4, occurring more than and not for at least 6 months about a number of events or activities, such as school or work performance. The person finds it difficult to control the worry. The anxiety and worry are associated with like 3 or more of the following symptoms: restlessness, or feeling keyed up or on edge, being easily fatigued, difficulty concentrating on mind or your mind going blank, irritability and muscle tension, and sleep disturbances. Then you have obsessive compulsive disorder. The obsessive compulsive disorder, or is either obsessive or compulsive or both. The reoccurrence is a reoccurrence and persistent thoughts, impulses, or images that are experienced at some time during the disturbance as intrusive and inappropriate, and that can cause marked anxiety or distress. The thoughts, impulses, or images are not easily excessive and worries about real life problems. The person attempts to ignore or suppress such thoughts, impulses, or images, or to neutralize them um, with some other thought or action. Repetitive behaviors like hand washing and ordering and checking, or mental acts, praying, counting, repeating words silently that the person feels driven to perform in response to an obsession or according to the rules that must be applied rigidly. The behaviors or mental acts are aimed at preventing or reducing distress or preventing some dread event or situations. However, these behaviors or mental acts either are connected in a realistic way with what they are designed or neutralized to prevent. So when you're anxious and you're overly anxious and you have these bottled up feelings, or you're feeling fear, or you're feeling worried about something, we do things such as drink or do drugs or cleaning, and like they said, the obsession of the washing of the hands and making sure everything is neat and clean to remove the feeling. And then we had some panic disorder, a discrete period of intense fear or discomfort in which 4 or more of the following symptoms develop abruptly and reach a peak within 10 minutes, like palpitations, pounding of the heart, or accelerated heart rate, sweating, trembling, and shaking, sensations of shortness in breath, feelings of choking, chest pain, or discomfort, nausea, or abdominal distress, feeling dizzy, unsteady, lightheaded, or faint. The fear of losing the control or going crazy, or the fear of dying, these are all parts of the anxiety disorder under panic disorder and obsession compulsive control. And then I'm just going to touch bases on post-traumatic stress disorder, which is the person has been exposed to a traumatic event in which both of the following were present. The person experienced or witnessed or was confronted with an event or events that involved actual or threatened death or serious injuries, or a threat to the physical integrity of self. So that can be physical abuse, or that was consistent as a child, or molestation or sexual abuse, or even a car accident where it was so horrific to the person, can become a stress disorder, and different things that remind the person of that can continue to persist and affect the person's feelings. The person's response involve intense fear, helplessness, or horror. In children, this may be expressed instead of disorganized or agitated behavior. The traumatic event is persistently re-experienced in one or more of the following ways: reoccurring and intrusive, distressing recollections of the event, including images, thoughts, and perceptions, recurrent, distressing dreams of the event. And in children, there may be frightening dreams without recognizing the context or where it comes from. Acting or feeling as if the traumatic event were reoccurring includes a sense of reliving the experience, the illusion, hallucinations, and disassociative flashbacks and episodes, including those that occur on awakening when intoxicated. Okay. Then we have mood disorders. So mood disorders, according to Davis Behavioral Health, reported that 1 in 10 adults suffer from some type of mood disorder. It is normal to experience mood swings from time to time, but people with mood disorders live with more persistent and severe symptoms that can disrupt their daily lives. Depending on the specific disorder, people may experience an ongoing sad, anxious, or empty mood, feelings of hopelessness, low self-esteem, excessive guilt, decreased energy, and more. Therapy, antidepressants, and self-care can help treat mood disorders. The most common disorder is major depression, dysthymia, bipolar, and substance-induced mood disorders. Major depression, there are more depressive symptoms that may last about 2 weeks or more, and must have either depressed moods and loss of interest and pleasure. Symptoms must cause significant distress or impairment, and no manic or hypomanic behaviors. Those are symptoms of depressions. Then you have minor depression or depressive episodes with 2 to 4 depressive symptoms for about 2 weeks or equal to 2 weeks or more, and must have depressed moods or loss of interest or pleasure, and symptoms must cause significant distress or impairment. No manic or hypomanic behaviors. That's minor depression. And then you have the dysmanic disorder, where depressed move for most of the time for at least 2 weeks. Presence of 2 or more of the symptoms of dysmania, never without symptoms of 2 months or more over 2-year period. And then you have symptoms must cause clinical significant distress or impairment. No major depressive disorder is in the first 2 years, or manic or hypomanic or mixed episodes. And then bipolar. Now, bipolar is something that consists of, and where is my bipolar stuff? That consists of 2 types. You have bipolar type 1 and you have bipolar type 2. And I don't have my stuff. And I'm going to try to talk about as much as I can. So bipolar consists of where they were talking about the hypomanic or the no manic part. So to be able to understand it or identify with the bipolar, let me see if it's in here. Sorry. The person will have to, okay, here we go. Sorry. So there's just so many clinical terms for bipolar, and I just don't want to give you the different types of information, but feeling depressed and come on, open up, there we go. Okay. Feeling depressed and very low at the time. And come on, save. The criteria have been met for at least one manic episode, and the manic episode may have been preceded by and may have or be followed by a hypomanic or major depressive episode. So in bipolar 1, there's usually a single manic episode, or most recent episode is hypomanic. And the occurrence of the manic and major depressive disorder is not better explained by the psychoaffective disorder or the schizophrenia form discord or disorder. The delusional disorder or others specified or unspecified schizophrenia spectrum and other psychotic disorders. Major depressive episodes are common in bipolar 1 and disorders, but are not required for diagnosis of bipolar. And then you have bipolar 2.
You're so right. When we would study these in medical school, it was kind of hard to differentiate bipolar 1, bipolar,
Yes.
and so I thought of it as just like, so manic meaning like you have episodes where, for example, someone could decide that they want to run for president or they want to start a new business and they sell all of their assets and like just a grandiose set of ideas, and then they just like go off on one end. And then the hypomanic would be the complete opposite, where now you're entering a state of depression, but in addition to having those, it's kind of just like hills and valleys, but extremes.
Extremes, exactly. Exactly. So those are in bipolar 1. They're the up and down parts. And the criteria, except for durations, are currently met for a manic or a hypomanic or a mixed or a major depressive episode in bipolar 1. All right, I have this down here. Whereas in bipolar 2, the presence of one or more major depressive episodes is there. The criteria have been met for at least one hypomanic episode and at least one major depressive. You have both those things are there. The mood symptoms and criteria are not better accounted by for schizoaffective disorder and are not superimposed of schizophrenia or schizophreniform disorder. And we're getting ready to go into that when we talk about the psychotic disorders. And thank you for explaining. That was a good example of the hypomanic and the no manic.
No problem. I just know that there were a lot of like clinical terms while I was learning it, so it's kind of hard
Yeah.
to put it in layman's terms.
Yes, it is. Okay, let's move on. Come on. So psychotic disorders are those suffering from psychotic disorders may be unable to know what's real and what's not. This group of mental disorders changes an individual's sense of reality. Scientists believe that certain viruses, problems with how specific brain circuits work, extreme stress or trauma, and some form of drug abuse may play a role in the development of psychotic disorders. The most common psychotic disorder is schizophrenia, schizoaffective disorder, brief psychotic disorder, delusional disorder, and substance-induced psychotic disorder. With the DSM-5, 4, I'm sorry, because I like that better than 5. It gives more meaning and more definition. Characterize the symptoms of 2 or more of the following. Each present for a significant portion during a time of 1 month with delusions, hallucinations, disorganized speech, frequently derailed, grossly disorganized or catatonic behaviors, and negative symptoms or affective flattening or avoid or abolition. So delusion meaning you're out of it and you don't have the understanding of what's going on with you. You may not know what day it is. You may be a little out of it, which can be caused by drugs or different medications or the mental health itself. Then it's the hallucinations, thinking you're seeing things or seeing things that's not there, and your speech can be affected. And the only one criterion or symptom is required for the delusion, and the bizarre or hallucinations consist of voice keeping up with running commentary on the person's behavior or thoughts, or 2 or more of these things. Voice conversing, talking to yourself, hearing the voices. So with schizophrenia or any psychotic disorder, the hallucinations and the hearing of voices could be a part of it. So this is something else, again, that we can't be ashamed of, because if we don't say, I'm hearing a voice, sometimes the voices is just like a hum or sound, or sometimes you hear a person really saying something. Sometimes it's related to persons that's no longer with you and you're still going through a depressive state, or sometimes it's just different feelings because you're unbalanced. So the chemical imbalance in your brain can be unbalanced and can be causing different things that's going on with you hearing these different voices, and it can be treated. But a lot of times I find, and with my experience in working with my clients who have schizophrenia, that the shame and the guilt of admitting that their voice is being heard. However, they have admitted that when I'm taking my medication, I'm fine and the voice is at a minimal and I can function. But the mere fact that I have to take this medication most of my life, and I think I'm normal when they're feeling really good and grandiose because the medication is stabilizing them, then they believe that I don't have to take this no more. But that's how they became stabilized, because sometimes the mood medications and different things are taken or are helping them. Continuous signs of disturbance persist for at least 6 months, and this 6 month period must include at least one of the symptoms to meet the criteria that you have schizophrenia. And the last one, I'm gonna talk a little bit about the dementia. Dementia, although mistakenly thought to be a single disorder, is a term that covers a wide range of specific mental conditions, and those suffering from dementia I'm sorry. Okay. And those suffering from dementia related disorders may experience a decline in their cognitive ability and often severe enough to impair daily life and independent function. Alzheimer's disease account for 60% to 80% of the dementia cases, while categories of dementia include a host of conditions, and it slowly destroys memory and thinking skills and eventually strips the ability to carry out the simplest tasks. So this is frightening and fearful to a lot of people, and it affects not just the person, but the family. There are other forms of dementia consist of Parkinson's disease, frontal temporal dementia, Huntington's disease, and the Korsakoff syndrome. One of the things about dementia is that's so frightening is that sometimes the person receive back with the Alzheimer's part, and they don't remember you, or they might think you're somebody else and different things. And we, as the caretaker, often are frightening, fearful, and not understanding. So with dementia, I suggest that anyone who has a family member who is experiencing dementia or Alzheimer's, search it and research it and look it up to understand it in order to be able to care for your loved one throughout throughout the end of their life or throughout their lifetime. A lot of times, most times, dementia and Alzheimer's is in older persons who are getting older and or having failing health. But sometimes dementia and Alzheimer's come in other persons that are young. I have a cousin who is going through Alzheimer's, and she is my age, but it's because of a brain injury and because of different types of surgeries, and that can also cause dementia and Alzheimer's. And lastly, the eating disorder. So the eating disorders require intervention from medical and psychological experts. And in all of these disorders, receive and need to have interventions and include medical and psychological experts and therapists, a whole team. You need a team to work with any of these disorders. So they are about more than an individual's relationship with the food. They're complex mental disorders that often require intervention from medical and psychological experts. These conditions cause unhealthy eating habits to deploy, such as the obsessions with food, body weight, or body shape. In severe cases, eating disorders can have serious health consequences and may even result in death if left untreated. Common symptoms include the severe restriction of food, behaviors such as vomiting and over accessing, and food binges and purging. The most common types of these eating disorders is anorexia nervosa, bulimia nervosa, binge eating disorders, picky eating disorders, and ruminations of disorders. Okay, and I did not search in particular different meanings, but I know anorexia is more with the binging and purging, and so is the bulimia, but you're eating, you're overly eating with the bulimia. Okay. And lastly, I want to talk about, there are ways that we can help ourselves, especially with stress and mood disorders, and our anxiety. I found, or I identified with 8 ways to improve your mental health, and looking at practicing of mindfulness. Mindfulness can help with stress and anxious thoughts and variations. This is the practice, and along with mindfulness is praying and meditation and reading devotion and having specific groups with spirituality. All of that is a part of practicing of mindfulness. This is the practice of focusing your attention on the present moment without passing judgment about how you're feeling or what you're experiencing. It's state of accepting things the way they are. It's all right to have judgment during this time, but practicing mindfulness means you dismiss them as fleeting thoughts. Just return to the present moment. And then there's exercise. Exercise is key. It stimulates the chemicals in the brain and leaves you feeling happier, less stressed, and more relaxed. And you don't need a gym. You can exercise at home. You can exercise at your desk at work, breathing exercise and different things like that, especially if things start getting overwhelming. Just sit at your desk, put your feet flat on the floor and sit straight up and erect, and just breathe through your nose and let it out your mouth and relax. You'd be surprised how much of the anxiousness will go away. And then eating, everything is about what we put in our bodies. Unhealthy diet taxes your body's ability to cope with the stress or the depression. If you're not healthy inside, you can't cope with pretty much of anything. So conversely, stress can cause unhealthy eating habits. It can cause you to have a loss of appetite. However, we need to be aware of these things, and we must find the energy to eat and eat right. We are what we eat, right? And a lot of that has to do with other diseases and different things. So if we have high blood pressure, or we have diabetes, or we have different things, even with substance use, we have to replenish our bodies all over again and build up our immune system and restore healthy cells to cause us to have a better mindset, which will help relax us and help us to focus back on, our recovery aspect. And then writing journals, a gratitude journal. Identify what you're grateful for. Document positive things in your life. And these studies shows that maintaining a gratitude journal lowers your stress and increases relaxation and fosters more positive outlook on your life. And then number 5 is give back. Eternal dialogue that plays repeatedly in our mind can be detrimental to good mental health. And maybe you're familiar with the negative messages. I'm not good enough, and low self-esteem, and causing yourself to go down. So so giving back and working with others and doing things to help persons where you have experienced different things and have overcome them. And then practicing positive self-talk, where you combat all those things about I can't do it and the low self-esteem. Do positive affirmations. I am a child of God, and God loves me for who I am, and different things of that nature. I was beautifully and wonderfully made and created, you know? So you want to practice the positive self-talks and dialogues and um and build yourself up and build self-esteem, and it'll help relax you too and remove some depression. And then step outside, go for a walk. Daily exercise can help improve your mood, chase away stress, and help you relax. But it but it turns out just being in nature also has mental health benefits. So um, go outside, you know, breathe some air and come from out of the darkness or the space that you're keeping yourself in, especially with depression. And lastly is seek help. Um, for some cases, these suggestions still fall short of achieving optimal mental health. And the best thing to do is to get help. Know that seeking professional counseling isn't a sign of weakness, rather, it is a symbol of self respect and dignity. Some of these suggestions may still fall short in achieving positive and optimal mental health. It takes a team of experts working together on your behalf. Know that seeking professional counsel isn't a sign of weakness, rather, it is a symbol of respect. So, from anxiety to depression to substance abuse, all of these challenges, it's okay. There's nothing to be ashamed of. The more we become aware and have acceptance of any mental health or any disorders that we may have, the better we can have the positive mental health that we talked about in the beginning, and building up your self-esteem and becoming control of your feelings and emotions, and knowing that God created us to be awesome human beings, and the renewing of our mind and the renewing of our spirit is through awareness, acceptance, and understanding, so that we can know where to persevere and where to seek to get better and better. And that's the end of my presentation.
Awesome, awesome.
Amazing, 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 Dr. Harvey.
Good job.
Thank you.
Excellent explanations for all of these different diseases. I mean, there's such a broad spectrum of mental health disorders, and you really hit the nail on the head with the more common ones. Now, we did have a bunch of really, really good questions from the audience. So
Okay.
I'm going to just go to the first one, and it was about anxiety. It asked to explain anxiety, which you already did pretty well.
Where the question is coming from and country and all the good stuff.
Well, so this person didn't introduce their country. This is
Okay.
Tesh Tesh. She's asking from Facebook, but she wanted to know how, I'll just read her question. How best can you explain anxiety? People mistake random fearful thoughts to be voices of God. So this question could be for you and also for Pastor Mark, because a lot of times we do have anxious thoughts. We have different emotions that speak to us. And then you have God and his will for us and him speaking to us. So how do we differentiate that kind of communication? How do we know what's us and our fearful thoughts versus what's God?
So in my spiritual self, I go to God for everything, and I pray and I ask to hear His voice, and sometimes I don't. So reading devotions and listening to the Word of God, through the man of God, and reading my Bible always give me another insight or perspective on where God is leading me to be. And then sometimes I know it's me because of the conviction, and maybe it's not just the right thing to do. And if I think it through out more, then I can understand it. And if the feelings go away, if it don't go away. It might be something going on, especially as I had explained, if it's lasting over more than 2 and 3 and 4 days, then maybe you might want to talk to someone, even if it's your pastor or another spiritual counselor. You can talk to someone, because talking speaks out and you can hear yourself, and then you can recognize your feelings and your anxiousness. So research it. If you're going through some feelings and there's a lot of stuff going on, and you're, especially if you're praying and asking God to hear, you want to hear from him, it can get conflicted. So if it's lasting and you got this feeling and this jitteriness and palpitations going on more than 1 or 2 days, then maybe you should call and reach out and speak to somebody.
So, thank you very much, Doc. Um, so, anxiety defined has to do with the uncertainties that has to do with an outcome. If there is going to be an outcome that you are not certain about, there is anxiety that comes up. You are feeling, there's a feeling of worriness, there's a nervousness, there's an
Yes.
uneasiness that comes in regard to anxiety. When it comes to hearing the voice of God and being fearful, having fearful thoughts and taking those to be the voice of God, um, one thing is for sure, the voice of God doesn't fear
Not
you. It doesn't scare you. The voice of
no,
God brings peace.
no negative.
Voice of God brings clarity. The Bible says the spirit that God hasn't given us a spirit of fear, but of
Yes.
love, of boldness, and of sound mind. Where we have anxiety is where we are not able to in the moment grasp how things are going to turn out. So people are anxious about have anxiety concerning the results of an exams. People have an anxiety concerning things that they have failed at before, and they are like, well, hey, probably this is going to be another repetition, and so on and so forth. Hearing the voice of God is supposed to be that element that sets the record straight. When you take God at His word, the promises of God is supposed to, as it were, lay down the worry. The worry is that I can't make it. The word of God says you will make it. So when you take God at His word, the word of God doesn't drive fear into you. It brings assurance. It brings a foundation. So when you're dealing with anxiety with reference to not knowing what outcomes are going to come, the voice of God actually brings direction. It brings the peace. It brings the
Yes.
focus that you need to be
Um,
able to come right, the calmness, and that is why, as you said in your presentation, sometimes it is prayer, in and that's my outlet. That's my outlet. When you get into that zone with God and you are just praying, sometimes you just pray, 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 and by the time you are coming out, all that burden is off. And that is what works for me. It may not necessarily work for somebody else, but when you feel anxiety, sometimes talking to somebody about how you are feeling also helps to be able to relieve the anxiety.
yes.
100%. I agree with all of that. And I think that what Pastor Mark is really emphasizing and what we all should remember is that God speaking to you is going to match his word. So what he speaks to you in your state of anxiety, no matter how fearful you are, it's going to match his word. He's not going to tell you. Oh my goodness, I saw this article some time back and it really, really struck me because there was this woman who, I mean, by all intents and purposes, probably has some sort of mental disorder. I can't diagnose her, but she sounded like someone who maybe was schizophrenic, right? And so she was hearing voices and she thought that it was the voice of God telling her that she needed to kill all of her children because they were all demons. And so
Mm,
she did kill them. And it brings up another uh, comment that I'm seeing here. This is from Tesh Tesh, actually. She says she's from Nigeria. And she was saying that many religious people actually like ignorantly hide their mental unwellness behind religiosity. And I think that's like something real that we should think and talk about, because we do, I mean, people have visions, right? You can see, people see angels, people see demons. We see examples of this in the Bible, right? But we do have people who are mentally ill and that are seeing hallucinations, that are
Yes.
hearing from things that are not of God. And so
Yes.
being able to differentiate that is super important, because
Yes.
you have a lot of people who hide behind that as angels of light.
Yes.
And
And God is good. So nothing from God is bad. And that's one of the things we can distinguish the difference of. If it's anything that's negative in your thoughts and feelings, then you know that is not of God. And if again, I can't stress enough that if you're feeling these overly whelmed feelings and anxiousness more than a day or 2 days to 3 days, then maybe there is something you need to, reach out to, or someone you need to speak to, just so that you can understand what's going on with yourself.
I agree. And then a lot of these mental illnesses that you spoke about earlier, there are criteria. So it's not just a one-off thing. It's not just,
Yes,
you know,
exactly.
about a situation. Some people have generalized anxiety disorder, so they're anxious about situations. They're anxious when nothing's going on. They're anxious about
Yes,
in social settings, and so
yes,
other symptoms within those diagnoses can kind of point you in the right direction, because maybe it isn't that you're hearing what you're supposed to hear. Maybe it's
yes, exactly.
okay. So many good questions here. So many good questions. I had another question about sleep. So, and this is from Don Cruz. Hey, Ella, how are you? Hi, Minister Ella. She's one of our biggest supporters, and she wants to know, can a lack of sleep and not resting affect one's mental health? And what's the right amount of sleep to have a healthy and sound mind?
Okay. So yes, a lack of sleep is a part of your healthy regimen, just like eating, um, eating and exercising and taking care of your body. So if you're not getting the appropriate sleep, you're going to be tired and you're not going to be able to focus in the right way. Sleep is, for me, is like eating a piece of chocolate cake. I love to get my sleep in, and when I don't, on days that I'm not able to, that day does not go well. And the other part is that uh what is she at the end part, but she said
Sleep in order to maintain a healthy, sound mind.
yes, so doctors and therapists and psychiatrists in their research say that we need to have up to 8 to 10 hours sleep a night. However, each person is different. I don't suggest that 4 and 5 hours I don't, from personal experience, it's not a enough sleep. But I've seen some people can go through a day like that, and it's okay with them. But it eventually catch up with you. You need your sleep. It's just like all a part of the essentials: drinking water, eating food, exercising, and taking care of yourself. You need your sleep.
Agree. It's actually kind of like a bell curve if you look at these studies. So young children, like infants, they need like a good 12. That's my child calling me. They need a good like 12 hours of sleep. And then
Yeah.
the younger you get, oh, I'm sorry. Sorry, they're going outside to play on the patio, and our alarm is very loud. But I was saying, so the older a child gets, the less sleep they need, right? So when they get to their adolescence, they may be able to function off of 9 hours of sleep. Then you get into your young adulthood, adults, we can do 6-7 hours of sleep. It's not ideal, but you can function with that amount of sleep. And then as you get older again, then your requirement starts to rise again. But as you said, everyone is different. Everyone needs a different amount of sleep individually. But one other big takeaway is that there's no substitute for sleep. So you can't just like undersleep and then over caffeinate and think that you can that's like not sustainable, because over caffeination comes with its own side effects as well. It increases anxiety. It increases a lot of those neurotransmitters increase in things like anxiety disorder.
Exactly.
And declines as well. So good.
Very good. Yes, very good. That's a good thing that you pointed out. If we only slept for about 2 or 3 hours and we jump up and start drinking coffee so that we can get some energy to go on, it is just not good for us at all. Very good point out.
Let's see. So another question: how can one control PTSD? You spoke a lot about a post-traumatic stress disorder, some of the things that can bring it on, but how does one control it?
So therapy is the biggest part for post-traumatic stress disorder, because a lot of times we suppress it. We suppress memories or events that hurt us emotionally, physically, and mentally. And we don't want to remember it. We don't want to think about it. And if we don't address it, then the least little thing can trigger it, after saying we suppressed this thing for years and years. And the least little thing that trigger it can cause you to have a whole mental breakdown. So when we go through things like losing loved ones and death, or the sexual abuse, or the physical abuse, therapy is the first thing. And all your professionals, your PCP should always be a part of your treatment plan, because especially if you have a doctor you've been seeing all your life, he should be the main person that refer you to the therapist or the psychiatrist and psychologist, and together as a team, they can work on what is best for you. So one of the biggest things of PTSD is addressing it, because we can't keep suppressing something. It's just like a boil, like it's gonna have to burst sooner or later. And it's not a good outcome at times when it do burst. Some of us have suppressed things as child and don't even realize that you have PTSD or anything that's in the past that's bothering you. And we're reacting out and doing different things from teenage life. So until then, and then now we're a whole adult, and now everything just finally pours out and pour open. We have to talk about it. We need to get the help. And it's not all the time needing no medications or anything, but talking about it, finding coping strategies to address it and how to deal with it. Maybe getting involved with groups that has the same issues that you have, where you can find out how other people have coped with it, and together, especially in certain group settings, you can, like pour things out and get things out, and being able to just look at how to cope with dealing with it. So yes, treatment and therapy. And I always suggest that you start with your primary care physician so that they can work together all as one team to help you.
Absolutely, I agree. I mean, so in the hospital setting, when taking care of a patient with any sort of issue, a lot of times there are multiple issues and multiple confounding factors.
Yes.
Whole team to take care of things. And so
Yes.
you have a patient that comes in for shortness of breath, and then you find out that they have heart failure. So now you have a cardiologist on board. Then you have a pulmonologist on board who's going to
That's right.
You have a chaplain on board who can supply their spiritual needs in the hospital.
Yes.
And I think it's the same with these mental health disorders, whether you're talking about PTSD, anxiety, depression, all of these things. It A lot of people look at it as either you're going to pray about it or you're going to seek help from a mental health professional and be on medication. It doesn't have to be an either or thing. I think a team approach is why we're all here on this earth. We all have different,
Yes.
we all have different strengths. So God
Yes.
is giving you wisdom about these mental health disorders. He's given me wisdom about,
Yes.
and things
That's
like
right.
that.
And together.
Wisdom about spiritual things. And so together, why not tackle an issue that can be
That's
multifaceted?
right.
That is not just, it's not always, okay, a demon possessed this person. And so now they have PT. It's not always just a direct effect of something spiritual. A lot of times it is, there's have been some spiritual attacks in this person's life, but also their serotonin is too low. And, you know, they're physically not able to deal with certain things. Maybe they're
Yeah. The equilibrium can be unbalanced. There
exactly,
might be any, all those things. Yeah.
exactly. And maybe they're also dealing with chronic pain on top of all of that. So now you
Yes.
need a pain doctor, you need a therapist, you need a pastor and a spiritual advisor, and you need that person to be emotionally well. And so
Yes.
I think it's a team approach. And I think that that's something that we really, really have to help our fellow brethren with, because it doesn't have to be either or.
Yes.
Not a weakness if
Exactly.
you turn to a mental health professional, or if you need to be on medication. We all have a thorn in our flesh about something. And God,
Yes.
He's still out here healing people. Absolutely. If He wills it, you're going to be healed just the way Jesus was walking around healing people.
Mm-hmm.
But if you're not healed and He's giving you wisdom, or wise counsel from someone that He gave the gift and the
That's right.
learn medicine and things like that, and then that person prescribes you something,
Yes.
like it's not confounding. That's together helping you to become better.
Yes. Thank you. Yes. Yes.
Anyone else
Perfectly.
input, or I can go to the next question? Actually, so the next question is similar to this. So it says, what is the biblical cure for mental health in the life of a believer to get off the medication?
Mm.
Because they
So,
the side effects that are not there. That was a follow-up.
okay. So again, the team effort, like your medical doctor, and your therapist. So if you're taking medications, that means you have a psychiatrist. That means that somebody prescribed this medicine for you to take and thought this would be best, and your medical doctor. And then you have your spiritual counselor, or the person that you're talking to, your prayer partner, and different things like that. Together, let's talk about it. Let's talk about it. Let's see why you feel like you need to not take the medicine no more. Is it causing really bad effects? Because a lot of times, especially with mental health, medication is a trial and error based. And and sometimes the first medications may not be the right medication. And no no psychiatrist knows exactly this is the best thing. So they know the medication and that the medication helps this. So when you're being honest and open to your doctor, you have to let them know exactly how you're feeling, exactly what's going on with you, so they know the right medication to trial you with. And when I say trial you with, it's because every time you get a medication, it may not be the right one just for you. However, when being open and honest about your emotions and your feelings, even your health and your physical health, you have to let them know all of that so that they can know what type of medications to give you. And then to answer the question is, um, um, how do you know, like when you're talking to them and you have a good doctor and a good psychiatrist and a good therapist and a good spiritual person, and you're talking to them and you're letting them know how you're feeling and you're feeling strong, maybe the medications could be less, and especially if it's causing you to sleep a lot lately, or is causing you to do different things differently than what you were doing in the beginning. And if you have been taking the medication for months and over years and stuff like that, maybe it might be time to lessen the amount of medications, and it might be time to slowly take you off, but just don't abruptly stop. Whatever you do, just don't abruptly stop taking any kind of medications that you've been taking on a daily basis, because then you're putting your body in shock. You're putting your body is saying, okay, where is that thing that was having me feeling like this and feeling like that again. You're striving to do it all on your own. And my sister Linda said that God gives us the wisdom, and he gives us the gift to understand these things and to provide the right information to you. So if you have a whole team, then you come off of it slowly and just not abruptly. Whatever you do, just don't abruptly stop. Let someone know, talk to your doctors and let them decrease the medication, to slowly bring you off, especially if they feel that you're really strong-willed and starting to be have a whole lot of stability. Because we don't have to take this medication all our life. A lot of times with the mental health, for instance, the anxiety or the depressive moods, depending on how you started it, probably too. So all of that plays a part in it. The holistic medical mental health is taking care of the whole person, their environment, your family situation, and your health, and your mental stability. The whole person has to be taken care of. Same thing that Sister Linda was talking about with the person coming to the hospital, one thing after another thing, and they have all of these different persons in their life, a whole team. Same thing with you at home too. Your whole environment, everything, could be going on, different stresses. The holistic person needs to be addressed.
Absolutely. I agree. Let me see. Is there any other
Before,
questions?
so that before you take the next question, um, is it biblically speaking, there are certain scriptures that also speak to mental health. Okay, um, the example of Jesus Christ in Mark chapter 6, verse 31, where after Jesus Christ has gone around healing people and so on and so forth, in Mark chapter 6, verse 31, he withdrew away from the people in order
Yes,
for him also to be able to reorganize himself.
yes,
So, one of the biblical ways by which you can have mental health is to take time out. Take time out to be by yourself, to rejuvenate, get in touch with yourself. Because we are so busy trying to be answers to people that we forget about ourselves.
yes.
So take time out. Take time out. It is biblical. Jesus Christ did it whilst he was here on the earth. So whether you're a pastor, you're a prophet, you are a child of God, I'm not saying take time off being a child of God. I'm saying take time off to take care of the body. Okay, to take
That's
care
right.
of the body. That is very essential. Another thing that we need to look at, you see, the fruit of the spirit gives us a very strong foundation when it comes to dealing with issues about mental health. Talking about love, talking about patience, all these those fruits don't fall from a tree that
That's
is
right.
I don't want to use the word, but it falls from a tree that is healthy, that has gone through a process. And
Mhm.
God wants us to be able to bring out those fruit with the help of the Spirit of God. Another thing that we need to also look at when it comes to mental health, uh, biblically is the power of positive attitude, and that's what you also spoke about. Philippians chapter 4, verse 8. And now, my friends, all that is true, all that is noble, all that is just and pure,
Yeah.
all that is lovable
Yeah.
and gracious, whatever is excellent and admirable, fill all your thoughts with these things. So, biblically speaking, the way we tackle mental health is for us to dwell on the positive attitude. Philippians chapter 4, verse 8. It says, fill your mind, fill your thoughts with the things that are lovable, with the things that are gracious. If you are always dwelling on the negative, you will soon bear fruits that have its negative connotations. So fill your thoughts with good things. All right. Another point, as far as having good mental health, when it comes to the biblical things, is confront your fear. You know, God hasn't given us a spirit of fear, but of love and of sound mind. God has given us boldness. You see, when your fear becomes something that is persistent and irrational, that becomes a phobia. So the problems that we have, we need to confront those problems and turn them to challenges. Then we can see the way out, because challenges have solutions. Okay, so that's what I can add with reference to biblical ways by which we can tackle mental health.
Oh yeah, no, that is so good. And it actually reminded
Yes.
me of, I mean, God, he knew that we were going to go through these things on this earth. And he actually like built in a mental health day for us,
Yeah.
which is said, listen, don't do anything, keep this holy, like just rest with me.
That's right.
Okay. And we know that he is the Prince of Peace, he's the comforter. So he built in a mental health day for us, knowing that, we'd be going through all of these struggles in life. So
Yes.
that's so important what you said, Pastor Mark, about just resting and retreating. And we saw Jesus do it, and we need to do it too. No matter how many things are pulling at us, all of us need rest and relaxation. That's one. The second thing that I thought about with the biblical references, so I know King Saul, if you remember in the first book of Samuel, I mean, he is somebody who was actually tormented by an evil spirit.
Yes.
I want
Yes.
to differentiate between a few things. We're talking about specific mental health disorders. We're talking about schizophrenia. We're talking about all these things. Not denying that there are instances where demons have a direct effect on one's mental health. And that, my friend, I don't know if medication is going to work for you. That you need to see.
You need Jesus.
So, I mean, we had the young girl who
Yes, Dr. Linda.
she was hearing things and she was seeing the future and she was speaking it, but that was a demon, and that needed, Jesus to lay hands on her or speak, cast those demons out. And there are, numerous instances of that in the Bible. And so this is not discounting spiritual authority and spiritual things that cause these kind of manifestations. You need to seek deliverance if that is the case.
Yes.
So not discounting that at all. Absolutely.
Yes, Dr. Linda, that is so great and so true when it comes to spiritual healing. And again, with Pastor Mark, we need to go away and just sit down and just do us. Sometimes that mental health day, we just need to recollect and just rejuvenate, because that's what Jesus did. He would always go in the wilderness, go somewhere and just pray and just be with his Father and be rejuvenated to continue his task.
Absolutely. At the end of the day, God is the creator. He created us. He created all of these hormones
Everything.
and emitters that we're studying.
Everything.
All we're just trying to gain an understanding, and I think that we definitely have more of an understanding today. So I want to thank you so much for your awesome presentation. I want to thank you for just your wealth of knowledge and your time with us. I know we've been here for a little bit, but it's just been such a So we appreciate that. And Miss Williams, we really appreciate you always. Thank you so much for your support, and thank you for helping us to facilitate this.
You're welcome.
I don't see any more questions in here, but if anyone else has questions, feel free to message us. We have our Facebook open. Definitely make sure you follow us on Facebook. It's Abundant Life World. Follow us on Instagram. It's abundantlife_world. And Pastor Mark, do you have anything you want to add before we close out? I know we're kind of running low on time here.
Right. So today really we wanted to be able to make sure that our viewers understand that it is not everything that is spiritual. There is also that physical component that you can apply to receive the due attention. So the wellness center, the behavioral wellness center at the Girard, if you're in Philadelphia, Pennsylvania, and that is where Dr. Renee Harvey is. That's where Miss Stacy Williams is. Find a way that you don't have to deal with these situations by yourself. Make a call. As you are praying, you are making some calls. As
Yes.
you are praying, you are having some therapy. As you are praying, you are connected to, there is nothing wrong with taking medicine. It doesn't make you less spiritual. If you take medication, it doesn't make you less spiritual. Okay, so please, pray, fast, do all that. It is necessary. But sometimes, if you are feeling suicidal, you need to pick up that phone and talk to somebody. Have a place of release.
Mhm.
And I don't do that much, but learn to laugh a little. Bible says a
Yeah.
merry heart makes a cheerful countenance. So
Yes.
learn to laugh a little. I know some
Mhm.
of us have to go for courses in laughter, but that is also one of the ways. I want to say a big thank you to Dr. Renee having for coming. It's
Thank you.
been great. I believe that our viewers have received worth of information. We're definitely going to run these programs and focus on specific mental health issues so that we know that this time we are just talking about bipolar disease, and we trust God for the grace to do that. And Miss Stacey Williams has been so resourceful in connecting the dots, and we want to appreciate you. Thank you, Dr. Linda, for coming and being the glue that kept everything together. Because
That's right.
there was no way I was going to start quoting scriptures with some of the uh, God bless you all for coming. I'm wishing the best of the day. One thing I always pray for is that those who come with the solutions, nobody takes care of them. And so I'm praying for you that
Thank
as you provide solutions to people, God will provide your solutions. He says that he that waters shall himself be watered by God. And that is what I'm praying for you, praying for Dr. Linda, Miss Stacy, and all the healthcare guys out there. We are definitely praying for you. Thank you so much. Judah, I don't know if you
Thank
have.
you. Thank you so much. Thank you again for welcoming me. And Dr. Linda, you have a whole realm of wisdom and information too. You did a great thing. Thank you. And thank you, Pastor. And I
God,
will keep you all in my prayers as well.
awesome, awesome. God bless you all. Thank you. Have a good night. Tomorrow we have service at 10 in the morning. It's going to be online. So please join us on the page. It's going to be a wonderful time. God bless you all. Good night.
God bless you too.
Good night.
Good night.
Good night.